I suffer with chronic boils, abscesses and lesions. They're really painful.
I remember this woman, she just looked at me and she was like, that's disgusting.
It just is unbearable.
Things get very, very inflamed and there is a lot of pus associated with it and deep abscesses. So she's a very extreme case.
Most people would just run for the hills if they took one look at it.
This programme examines dermatological conditions and the procedures involved with treating them. Due to their graphic nature, viewer discretion is advised.
I'm really looking forward to seeing Dr. Emma because I feel like I've exhausted a lot of avenues.
Oh yeah, I've got an appointment to see Dr. Emma.
I've tried a lot of things and a lot of things haven't worked for me. I'm Elise, I'm 25. I suffer with chronic boils, abscesses and lesions that then burst. I get it under my arms, in my groins, my legs, my lady bits, my belly, under my boobs. They're really painful.
My own mother had it, I have it, and now Elise has it. So I do feel, it's my fault. Elise's has been far worse than me. Under her arms is horrendous.
This is my normal routine of a morning. Get up, clean my arms, I put dressings on. Here, this is from overnight. So it looks like a big sweat patch, but it's actually where my arms have drained. And it's all sticky and gunky and fluidy. Yesterday morning I woke up and it had all burst under my boobs, so I had to clean that up and put dressings on. And this one's on mainly for pain because when it's out and got the oxygen to it, it just is unbearable.
It's just something you have to learn to live with, but it's really, really painful and debilitating, and the actual pain feels like I can only describe it as someone with a hot knife or a hot screwdriver screwing into you.
If I go out walking and it can just be a casual walk, within 20 minutes, half an hour, I'm limping because there's a lump come up somewhere, or one that I didn't realise was there and I've aggravated it because I have been doing that extra walk. And then you struggle with your weight because I've ended up taking comfort in food because you enjoy eating, and when you're eating, you're not thinking about the pain you're in.
Yeah. I think dating has been difficult for Elise because most people would just run for the hills if they, took one look at it, really. So, yeah, it's been a hard time for her.
I remember one time I was sat out in a pub garden and there was me and my friends, and I had a lump under my arm and it burst, but I had an open top on. So I literally, and it was quite a big one and it was draining. And I remember this woman, she just looked at me and she was like, that's disgusting.
If Dr. Emma is able to do something for me, I feel like it will change my life dramatically.
Hi, Elise. Hi. I'm Dr. Emma.
Hello.
Nice to meet you. Do you want to come with me?
You.
Just follow my clippy-cloppy heels, my tap-dancing shoes. So, Elise, can you tell me a little bit about what you've come with today?
So I've come with a skin condition called hidradenitis suppurativa.
How long have you had this for?
Probably since I was about 8, 10, when it first started to form. I was quite young, and then gradually it's just got worse and worse over the years.
Why people get it, we really don't know. It does affect about 1% of the population. Yeah. That's a lot of people. Yeah. Hidradenitis suppurativa is a chronic, so a long-term skin condition, and it's very inflammatory, so things get very, very inflamed, and it causes destruction, really, of the follicles. There is a lot of pus associated with it, and deep abscesses.
Still, I've done a bit of extra walking, and I can already feel in my groin a sore bit.
Okay.
I'm forever having to clean my arms, and they always stink. I'm always having to try and wash them and use antibiotic lotions, and that's the only thing that really helps me with the smell. But it's affecting work now. I know that in the next couple of years, if I let it get much worse, that I won't actually, because I'm a hairdresser,
And how's it affecting your work, do you think?
Well, I can't really lift my arms up. I'll move back and forward, but that's about my range. So I've just had to learn to adapt.
And do you do that because you don't like the idea that the scars are there, or the pain
because
of the
of the pain.
Because of the pain.
Because of the pain.
I think that's what a lot of people don't realise from a skin condition like this, that pain is debilitating.
Yeah.
I want to have a look at your skin, if that's okay, and just get a feel of the severity of it. You can put your head back against the pillow, and then I'll move the bed up a bit so you're not lying down quite so much. I'll fold you in half. Okay. So this is really, really quite inflammatory disease that you have. These ones here look like they've been open for a long time.
Yeah. They've probably been open 2 or 3 years.
Okay. And they've never really healed over?
No, never.
It's so inflammatory, it's not allowing them to heal.
Yeah.
You've got these tracts that have formed. A tract is where we see something on the outside, but it's almost like a tunnel going deeper down into the skin. And at all of those points within that tunnel is whenever the infection can then effectively set up, and that's whenever you end up getting an infective problem on top of your inflammatory problem. And then you have the scars, obviously, associated with the old lesions. Can I have a look at the other side now? Okay.
And that is so painful. That feels like it's on a nerve every time I move my arm.
Yeah.
It makes me like jump out the chair or...
That one looks very inflamed. You can see the normal skin in between it, but then you've got these abscesses either side. Elise has been through all of the conventional forms of treatment. Antibiotics, the topical treatments that typically people will use. She's also had surgery in the past to try and remove the skin in this area, and that broke down and the disease recurred around it. So she's a very extreme case. Because you've tried all other kinds of medicines to date, you really fit into the category of somebody who will be able to do well, probably on a drug that's a biological treatment. Your disease has to be at a certain level of severity before you should be offered it. It's not something for everybody. These medicines, they're very clever. They work just on one part of the pathway of inflammation and stop that. These are molecular-based drug treatments. It does carry risk. It can increase your risk of developing a cancer. It can cause problems within your own immunity.
And it just worries me, like, the side effects of it, really.
With any drug at all, there's potential side effects. But in most cases, people tolerate it incredibly well. And for many patients, it can be quite life-changing, actually, the effect that this medicine can have.
Yeah.
It's about trying to weigh up and understand what the risk is truly for you, and the benefit that you could potentially have from being on a treatment like this. What do you think of that?
Yeah, I'm willing to try anything now, I think, well, to an extent, because you get to the stage where actually I'm like, I have to do something about this now.
Yeah.
So, yeah.
So we'll get everything set so that we can start on this.
Yeah.
We have to set up a separate appointment with your blood tests and things like that, just to make sure that everything's all okay, and then start on the medicine.
Yeah.
And you'll have really good support the whole way through it. You know, you'll have a nurse that you'll be able to be in contact with. All of your blood tests are all going to be kept an eye on. You'll have appointments to see us.
Yeah. Thank you.
I'm feeling excited now. I'm feeling ready to start some treatment and see what happens. Hopefully it means that I've got a better quality of life in the future if these treatments work. Feeling positive. It's been about 8 weeks since I started my treatment. I showed really good signs at the start, and it's kind of fluctuated up and down between good and bad days. But I'm still feeling optimistic about it.
Hi, Elise.
Hello.
How are you doing?
Good, thank
Good to
you.
see
How
you.
are you?
Good, come with me.
Good.
Come and have a seat up on the bed, Elise. So nice to see you.
And you?
You gave me a call this week because you'd had a cyst that had come up that burst, is that right?
On the base
Opened
of my
again?
spine. Was healed last time I came, and then it burst open on
Saturday and just went everywhere.
Okay.
So I was like, no.
Yeah, that's not a setback or anything. I know that you might think that it is. This is early days, kind of in the starting of this medicine. Just have a good look, is that okay?
Yeah. What do you want?
Yeah, this one. Okay, good. Okay, so I'm gonna have a little press on this, if that's okay. Yeah, there's a wee bit of discharging from that sinus. But actually, there's still a big reduction in the actual lesion count. Can I have a look at the ones that were on this side now? Is that okay? Because, oh, this was this one that was quite big, actually, whenever we very first met. That looks much better. So there's really good. Okay, so I think overall, from day one, starting the medicine, things are looking much better.
Loads better.
Good. And in terms of the dressings and things, is at the beginning you were in pain all the time, you were having to wear dressings every day. Thinking about just those factors, what's the difference in that now?
Pretty much everything. I barely put dressings on now. It's rare that I have to put a dressing on.
To have my hands treated, it would mean the absolute world to me. It would mean I'd be able to go back to doing normal, basic things. I could stay in my job, could just be a normal 24-year-old living her life.
Hi, Abby.
Hello.
Hi, nice to meet you.
Nice to meet you.
I'm Dr. Emma. Come with me.
Thank you.
This hoodie is amazing. I'm looking at it filled with complete
Thank you so much.
Just hop yourself up on the bed here, facing me. What have you come along with today?
So the past couple of years, I've had this really dry, scaly skin on my hands. I've been back and forth to the doctors, and I've had different diagnoses, contact dermatitis or fungal infection.
What do you do for a job?
I'm a veterinary nurse.
What an exciting job.
Yeah, it's exciting. It's busy.
And it started on which hand, first of all?
It started on this hand
On your
and then
left hand.
spread onto this one and has gone up here, and now it's on this foot.
Okay. Well, I'd quite like to have a look at your skin now, if that's okay. I'll let you pop that mask on. I'm going to pop this one on. And then if you're okay to take off your gloves and your shoes and socks.
Yep.
Brilliant. Okay. Oh, dear. Oh, you poor wee thing. This looks really sore. It looks like a lot of these pustules have done their popping, and it's now just very dry and scaly and inflamed.
Yep.
Okay, and then you've got the same thing over here. The whole bottom of the foot is fine. Okie dokie. You've got these changes on the palms of your hands, and one of the things that we always have to think about, could this be an infection that's caused it? And the commonest type of infection, particularly in somebody who works as a veterinary nurse, is could this be a fungal infection? And you know, I've seen people who've worked with animals who have picked up funguses from a hedgehog or a dog. Once it starts to be on the other hand and on the foot, I have to say being a fungal infection is probably further down my list. And we have to think, could it be something that's irritating the skin? Or is this an inflammatory condition of something like palmar plantar pustulosis? Palmar plantar pustulosis is a chronic inflammatory condition of the skin where something within inside the body is causing that inflammation, and you see it only on the hands and the soles of the feet. Can you think yourself of any trigger a couple of years ago that might have caused this? Was there an increase of stress in your life?
Probably stress. I went through a breakup, and then my exams were happening, which I wasn't doing very well at.
Interestingly, one of the things that can trigger this off is stress, and I think that that's probably been the case for you. But what we can do is, now that it's been triggered, is find out a way of how to control it. I'm going to optimise the topical type of treatments that you're having on the skin, but I do need to make sure that there isn't a funny fungal infection that you might have picked up at your place of work. So we'll take some scrapings of that today.
Okay.
Fungal infections we'll normally see on one hand, but this is both of her hands. She's got a little bit on her feet. So that's why this is much more likely to be palmar plantar pustulosis rather than fungus. But the problem is, if I treat her for palmar plantar pustulosis and don't rule out a fungus, and there's fungus there, well, then that would just get a whole lot worse. Motty and Rosie, this is Abby. How are you?
Do you mind to get me a banana blade and a black envelope? Thank you. We tend to try and take it from the edge. Is it a bit tickly?
Feels very nice.
Don't try this at home. So I'm just taking off the dead skin cells here. If there's any fungus in this, you can see it under the microscope as long little kind of like strings of spaghetti. And now I'm just going to take a little swab. Yeah, so taking the scrapings and taking the swab just helps us to identify any little organism that might be living on your skin.
Okay.
I'm prescribing Abigail some washes for her hands, some creams to start to build up the skin barrier, and some creams to settle the inflammation that's there.
Thank you so much.
And then once I've got this scraping result back, then I'll decide what our next course of action is.
I'm so pleased that I've come to see Dr. Emma today. She's been absolutely amazing. She's been really, really supportive. So I just got to wait back for some test results and hopefully some treatment soon. It's been 2 months since I've seen Dr. Emma, and my hands are so much better than they were to begin with, and my life is so much better now. When I looked at my hands before, it made me cringe and it felt so painful, and it just made me feel really, really insecure about myself. But obviously when I'm looking at them now, I can see that they are healing, which is incredible. Down. I think my biggest relief out of all of this is knowing that my job and my career working with animals isn't what's causing this condition, because I can continue to do my job, which I love.
Abigail was withdrawn, really, really stressed, and she didn't deserve it.
It's nice being able to feel their fur. Like, I know that's so petty, but it's nice. No more. You can have one more.
Seeing Abigail so happy, actually, it makes my heart melt. It's just overwhelming just to see her, how she's changed. I want her to be happy in her life and not be held back because she's got a condition.
I think Dr. Emma has absolutely changed my life. I can just be a normal girl now, and I'm so, so grateful. I can just do the little things like brushing my hair, brushing my teeth, because holding the toothbrush was painful, cutting up my dinner, walking the dogs. So that's fantastic. Done. Excellent.
Hi, I'm here to see Dr. Emma.
If Dr. Emma could treat him and get him better, it would just change our lives.
No one so far has been able to help, so if Dr. Emma could possibly diagnose me and give treatment, I'll be ecstatic.
Hi, is it Aldrin?
Hi.
Hi, I'm Dr. Emma. Do you want to come with me? Tell me what's brought you along today.
Basically, I'll get these lumps or boils that form under my skin, and sometimes they can break through with pus or blood.
Oh, no.
The very first one was on my side. That went away because I popped it.
Of course.
Yeah, but that's the only relief I can get. But ever since then, it's just got more and more aggressive.
Yeah.
But the main areas that really bother me is my armpits and my bum cheeks.
What is this like when it's at its worst?
It's just, I can't bear the pain. Like,
Yeah.
I spend days in bed, run down or stressed. I've decided off work, stopped going to the gym, and I don't take my boy out as much, so...
Yeah. Oh, Aldrin, that sounds pretty awful, so it does. And you've not had a diagnosis? Nobody's...
No one's diagnosed.
OK. Well, I'll need to have a look at everything so that I can give you the formal diagnosis and then hopefully come up with a plan that's going to start making things a bit easier.
I hope so, too.
Let's look at the armpits first. Oh, yeah. You know, so you can see how angry the skin's been for quite some time. But you've described them as boils, and that's kind of pretty correct. That's what they are, deep-rooted cysts. So whenever you squeeze these, bits of pus might come out of it.
Yeah, it does. Yeah. Like, it gets really big and it starts to leak.
Leak, which are the clue as to, you know, what's going on, really. Already, I know that this is something called hidradenitis suppurativa.
OK.
Oh, yeah. All over, aren't they?
Mm-hmm.
And these are deep as well. You can feel the boils underneath. Hidradenitis suppurativa is a condition where certain follicles within the body, usually in the groin, buttocks, or the armpits, become blocked. And the products that are inside the follicles, they break down and start to cause an immune reaction, and you get lots of inflammation. And it usually presents as boils and abscesses, and it can cause lots of scarring. You know, this is what your normal skin looks like. It's perfect. And normally the buttock skin is even more perfect because it's just protected all the time. But it's much, much, much darker, telling me how much inflammation has happened here. Okay, Aldrin, I'll let you get back into your clothes now. Hidradenitis suppurativa is actually a common condition. Probably about 1% of the population might have this. It's also a condition that not too many people talk about. And because they don't talk about it, often it doesn't get diagnosed for some time. It is heavily associated with people who have anxiety and depression because it's such a burden, essentially, to carry around all the time. And usually it's built into your genetics. We can't change that, but we can control it enough that it doesn't bother you in your day-to-day life.
That's like the most I'm looking for. That would be good enough.
So I'll give you some creams just to kind of help out with the skin. And, you know, these are very painful whenever they get inflamed.
Extremely.
So we need immediate pain relief that can kind of help you cope. And then I would quite like to put you on a medication to try and switch the process off for the pain point of view, and also so that you can go, right, okay, I can stop being so tired, I can do the things that I want to do.
100%.
So we've got a plan.
Yeah,
and we're on your side through this journey.
The best news, literally. And to know that there's steps to be taken to go forward towards it, that's even better.
Oh, good. To leave this and not treat it, it's going to repeatedly keep going through this cycle where new follicles will start to become inflamed. This is having a huge impact on Aldrin's life. It's intensely painful. It's also really knocked his self-esteem. He's somebody who wants to go to the gym and play with his kid, but he can't really do all of those things. To have your skin really hold you back in that way, it's quite upsetting.
I'm feeling a bit more excited. Dr. Emma definitely knew what I had. She diagnosed me and she's starting a treatment plan for me. And I have hope and faith that I will get better.
I'm here to see Dr. Emma today because it's my first checkup since I started the medication.
To have someone listen to me and knowing what I have, it's made me feel better. I'm feeling positive and hopefully she'll see the results.
Hi, Aldrin.
You all right?
You all right? Yeah, come with me. So, it's good to see you back.
Yep.
And you look quite different to when I saw you last time. Tell me then, how are you feeling now?
From when I first came in, obviously I feel a lot better.
Good.
I was depressed, grumpy, I had a bad attitude. I barely played with my son, I wasn't going to work, couldn't go to the gym. Now, everything is like 10 times better. I can sleep comfortably, I can walk properly, I can go training, I can go and work. Constantly playing with my son.
Oh, good.
That's the best part about it. I tend to get a flare-up or two, but the pain is just so much better.
Good.
So much better.
Well, we're on the journey. OK, can I have a little look? Is that OK?
Yeah.
Grand. OK, Aldrin, let's have a look. Is that all right?
Yeah, I guess so, again.
OK, have a peek. What a difference! This is great, isn't it? These ones here have all gone flat now. Brilliant. OK, let's have a look here. Now, this side is amazing. Your skin looks lovely. No, there's nothing new at all here. This is all absolutely fine. That's so good. OK, so now I want to have a look at the buttocks. Is that OK? Right. Again, this is really nice and flat.
It's a lot smoother.
Isn't it? It's much smoother. Very good. These ones now have all cleared, which is good. But this one and this one are a bit active.
And it's so sore.
So why don't I inject those ones?
Go on, let's do it then.
Yeah? OK. So it's just a little steroid injection. Don't you worry. That will help to switch off the pain and inflammation a bit more quickly.
Okay.
So you'll just feel a wee tiny scratch and a wee tiny push, wee tiny push. There we go, done. And a wee tiny scratch, very good. That's great, well done, all done. You are made of tough stuff. Okay, Aldrin, well, things are looking really, really good. And with the medicines that you're taking and the creams, hopefully we'll get all of this completely clear for you.